Assalamu alaikum. My name is Mosam Ali, and today my topic is congenital heart disease. Now, first we will discuss about classification of CHD. ए साइनोटिक होती हैं जिनको हम पिंक बेबी कहते हैं, और साइनोटिक होती हैं ब्लू बेबी. जो ए साइनोटिक होते हैं उसमें वॉल्यूम एंड प्रेशर ओवरलोड कर जाता है, और जो साइनोटिक होते हैं उसमें पल्मोनरी ब्लड फ्लो इंक्रीज कर देता है या लो हो जाता है. टाइप्स: atrial septal defect, an abnormal opening in the atrial septum which allows oxygenated blood from the left atrium to mix with deoxygenated blood into the right atrium. Right atrium receives blood from SVC, IVC, as well as from left atrium, leading to volume overload and pulmonary congestion. Occurs in about 4 to 10% of CHD. Types of ASD: three types हैं: ostium scandum, ostium premium, sinus venosus. Number 1, मोस्ट कॉमन जो है वो इसमें मोस्ट कॉमन जो है ना वो ओस्टियम स्कैंडम है, 50 to 70% इन द मिडल ऑफ द सेप्टम इन द रीजन ऑफ फोरामन ओवेल. 30% ओस्टियम प्रीमियम लो पोजीशन में होता है और फॉर्म ऑफ एवी सेप्टल डिफेक्ट. साइनस वेनोसिस लीस्ट कॉमन 10% साइट एट एंट्री ऑफ सुपीरियर वेना केवा इन राइट एट्रियम. Clinical presentation: most infants and children are asymptomatic, but over years to decades may experience these symptoms depending on type and severity of ASD. Infants get tired during feeding. Childs get tired with playing, eating, shortness of breath, fatigue, sweating, palpitations, growth retardation. Diagnosis: on auscultation S1 नॉर्मल होती है, इसमें S2 जो है वो वाइडली स्प्लिट एंड फिक्स्ड विद P2 accentuated. Ejection: systolic murmur is present. Chest X-ray: mild to moderate cardiomegaly with enlarged right atrium and right ventricle, increased pulmonary vascular markings. Echocardium: position, size, signs of LR shunt. ECG changes specific to ASD. ये जो डायग्राम एक्सरे दिखाया गया. अब मैनेजमेंट इसकी क्या है? 20% of atrial septal defect will close spontaneously in the first year of the life as the child grows. For defect of 3 to 8 mm or smaller, sporty medical management, digoxin, diuretics, and paraphyletic antibiotics are sufficient up till spontaneous closure. If defect is greater than 8 mm, surgical repair may be required. If spontaneous closure does not occur by school-going age, surgical repair becomes essential to prevent lung problems that will develop from long time. Surgical repair: defect may be closed with stitches or special patches. Ventricular septal defect, जिसको हम shortly VSD कहते हैं. An abnormal opening in the ventricular septum which allows oxygenated blood from the left ventricle to mix with deoxygenated blood in the right ventricle. Right ventricle receives blood from right atrium as well as from left ventricle, leading to volume overload and pulmonary congestion. VSDs are the most commonly occurring type of congenital heart defect, occurring in 4 to 17% neonates per year. Types of VSD: इसकी भी 3 टाइप्स हैं: सुप्राक्रिस्टल VSD, मेम्ब्रेनियस VSD, मस्कुलर VSD. अब जो है सुप्राक्रिस्टल VSD occurs just beneath the aortic valve at the left ventricular outflow tract. Membranous VSD, the most common type, and originate inferiorly. Muscular VSD occur in mid-intraventricular septum. Clinical presentation: sign and symptom vary with the size of the defect. Infants with moderate to large defect will become symptomatic within the first few weeks of life. Shortness of breath while feeding, poor growth, failure to gain weight, frequent respiratory tract infection. If reversible of shunt occurs, cyanosis, clubbing, respiratory distress. Diagnosis: on auscultation, pansystolic murmur is present. S1 is masked by the murmur. S3 can be heard at the apex. Chest X-ray: cardiomegaly and increased pulmonary vascular markings. Treatment: मेडिकल मैनेजमेंट, डाइटॉक्सिन देंगे हम, जिसमें डायरेटिक्स देंगे, एडिक्वेट न्यूट्रिशन, हाई कैलोरी फार्मूला और ब्रेस्ट मिल्क, सप्लीमेंटल ट्यूब फीडिंग्स एट्सेट्रा. सर्जिकल रिपेयर: क्लोज्ड स्टिचेस और स्पेशल पैचेस. Interventional cardiac catheterization. Outcomes of surgery: 95% occurs rate. Growth of child catches up in 1 to 4 years. Patent ductus arteriosus, जिसको PDM कहते हैं, PDA. Failure of closure of ductus arteriosus. Incidence: mostly in premature infants or infants born to a mother who had rubella during the first trimester of a pregnancy. Through the PDA, oxygenated blood passes from the aorta to the pulmonary artery and mix with the deoxygenated blood, which goes to the lungs. Blood volume to lungs, causing pulmonary hypertension. Clinical presentation: shortness of breath, congested breathing, disinterest in feeding or tiring while feeding, poor weight gain, sweating, tachypnea, bounding pulse. On auscultation, continuous machinery murmur in the left intraclavicular region. मैनेजमेंट इसकी क्या है जी? मेडिकल में इसको हम देंगे इंडोमेथिसिन देंगे IV intravascular may help close a PDA. It works by stimulating the muscles inside the PDA. The PDA to constrict, thereby closing the connection. Digoxin देंगे सेम या डायूरेटिक एडिक्वेट न्यूट्रिशन देंगे. हाई क्लोरी फार्मूला ब्रेस्ट मिल्क. सर्जिकल मैनेजमेंट. Repair is usually indicated in infants younger than 6 months of age who have large defects that are causing symptoms. Transcatheter coil closure of the PDA. PDA ligation where stitches or the vessel connecting the aorta and pulmonary artery may be cut and catheterized. Cyanotic heart disease, वो जो हमने पहले डिस्कस किया था अभी तक, वो acyanotic था. These types of defect lead to either increase or decrease pulmonary blood flow. The shunt present is predominantly from right to left, leading to shunt of venous blood without passing through the lungs to be oxygenated. Oxygenated blood circulate in arteries. Cyanosis, for example, tetralogy of Fallot, yeah, TGV. Number 1, tetralogy of Fallot, a complex condition of several congenital defects that occur due to abnormal development of the fetal hearing heart during the first 8 weeks of pregnancy. Ventricular septal defect, pulmonary valve stenosis, overriding aorta, right ventricular hypertrophy. Due to pulmonary artery stenosis, RV has to work harder to push blood into the lungs, thereby increasing the RV pressure and size. Presence of VSD facilitate blood to pass from the RV into the left ventricle and mixing of blood takes place. Overriding of aorta. The aorta sits over the VSD rather than just over the left ventricle. As a result, oxygen poor blood from the right ventricle can flow directly into the aorta. Decreased pulmonary blood flow and poor oxygenated blood circulating through the body leads to cyanosis. Clinical presentation: cyanosis, bluish color of the skin हो जाता है इसमें. Irritability, lethargic, reduced physical activity, fainting, clubbing of nails of fingers, toes, breathing difficulty, etc. Diagnosis: on auscultation and ejection, systolic murmur is present at the left ventricle, parasternal region, third ICS, due to pulmonary stenosis. Management इसकी क्या है जी? Requires a surgical repair usually undertaken at 6 to 18 months age. It involves closure of VSD with a patch to correct the override and the pulmonary stenosis is relieved. Transposition of great vessel, जिसको हम TOG कहते हैं. The aorta is connected to the right ventricle and the pulmonary artery is connected to the left ventricle. Oxygenated poor blood, जिसको जो blue हो जाता है, return to the right atrium from the body, passes through the right atrium and ventricle into the misconnected aorta back to the body. Oxygenated rich red blood return to the left atrium from the lungs, passes through the left atrium and ventricle into the pulmonary artery and back to the lungs. Clinical presentation: cyanosis, bluish color of the skin, lips and nails pads that occurs with such activity as crying or feeding. Rapid and labored breathing, cold and clammy skin, failure to thrive. Management: admitted to NICU on ventilator support, cardiac catheterization, balloon atrial septostomy, IV prostaglandin administered. By second week of life, TGA repair is done. Management is complex with high mortality. Thank you so much.